So my name's Amanda. I'm going to be doing a sterile field. First thing, I'm at the nurse's station, and I'm going to check my doctor's orders, and I'm going to check my policies and procedures. I'm going to make sure that I do not need to wear any type of PPE for this procedure. I have everything that I'm going to need. So now I'm going to leave the nurse's station, and I'm going to go in and gather my supplies from the supply closet. So I'm going to go ahead and wash my hands. I'm going to gather all of the supplies that I'm going to need. Since I touched this table, I'm going to just re-wash. I am going to gather up my bowl. My bowl is sterile. It is intact. It's within expiration. My field is also intact. It's sterile, within expiration. I've got a couple of sets of gloves. I'm checking the expiration, make sure everything's intact. Then I've got my 4x4s. Again, all of those are within expiration. They are intact. Then my fluid. The order was normal saline, 0.9%. That's what I have here. It is within expiration. It is unopened. So I'm going to gather my stuff and go into the patient's room. Knock, knock. Hi, I'm Amanda. I'm going to be your nurse today. How are you doing? Great. Give me just 1 second. All of my surfaces are clean and dry, so I can set my supplies down here. And I have everything ready to go. Can you go ahead and give me, let me go ahead and wash my hands. Can you go ahead and give me your name and date of birth? Jesse Wilson, 6'9", 1942. Great. Let me verify that with the your chart. Yes, I do have Jesse Wilson, 6'9", 1942. Are you allergic to anything, Jesse? Bactrim. What does Bactrim do to you? Okay, gives you a rash. We will not be giving you Bactrim today. Are you allergic to any tape, iodine, shellfish, any betadine, latex, chlorhexidine? No? Okay, great. What we're going to be doing today is we're going to be doing a sterile field. This is sterile, and I ask that if you need to talk, cough, sneeze, anything like that, I'll just need you to turn your head to the wall over there. This shouldn't take us a few minutes. I'm just going to set this up for the physician. Do you have any questions? Great. All right, I'm going to get started. If you have any questions, let me know. I've went ahead and pre-set up my red bio bag already in my trash can. So now I'm going to go ahead and get everything ready. Okay. Any additional supplies that I may have, I'm going to just set off here if I do need them. All right, so I am ready to go. Everything is good here on my orders. I've set my table up that is right here at my waist so I don't drop below my waist. I'm going to go ahead and open my field away. Okay. I'm going to reach into my towel, not crossing over my 1-inch border. I'm going to go around here to open up this side first. Then I'm going to come back around. I'm going to open up this side next. Even though I've dropped over the side of my table, it's okay because I've reestablished my 1-inch border, so I know where my 1-inch borders are. The next thing I'm going to do is I'm going to grab my bowl. I'm going to step back so I don't cross over my sterile field. So I'm going to open it up away from me. Side, side, forming a mitt. Then I'm going to reach in, there's a fold. I'm going to reach in to pull that away without crossing the bowl. I'm going to set this in. We're only The sterile portion of this is crossing over. Okay, and then I am going to dispose of this. The next thing that I'm going to do is I'm going to open up my 4x4s. So I'm going to grab my 4x4s. I'm going to grab them, and then I'm going to open them up a way as to not cross the 4x4s. I'm going to give myself a little bit of room if I cross over a little bit. So without crossing into my field, I'm going to go ahead and dump those. I'm going to back away, and then I'm going to drop into the trash can. The next thing I'm going to do is I'm going to get my fluids, and my orders call for 0.9% normal saline. That is what I have. It is within expiration, and it is unopened, but I'm going to go ahead and lip. Once this has been open, it's good for 24 hours, and you can reuse it. You have to lip in order to clean that. So that's what I'm going to go ahead and demonstrate now. I'm going to open up the lid. I'm going to keep the lid open or facing up, as this is another sterile field. I'm going to go ahead and step back. I'm going to lip my solution. Then with the same side I lipped on, I'm going to go in with the shortest distance, keeping my eyes on my sterile field. I'm going to go ahead and just barely come in and pour my solution as to not splash, and it's from the same side I lipped on. Then I'm going to go ahead and place the lid back on sterilely. I'm going to go ahead and date, time, and initial. Make sure everything is on there, as this is good for 24 hours. And I'm going to set that right there. Now I'm ready to put on my sterile gloves. Again, keeping my eye on my sterile field. I'm going to get my sterile gloves. I'm going to go ahead and I'm going to just wash my hands one more time, just to make sure, since I did open up that solution. I'm going to go ahead and do that. All right, so I'm going to go ahead and open my sterile gloves, not to cross. Grabbing within my 1-inch border to open them up. Once I have established my 1-inch border off of the table, I cannot move them. I'm going to step back, I'm going to move, and I'm going to grab the first glove. I'm going to come straight up to not drag my fingertips. Okay, I'm going to push this in. I can go ahead and adjust this cuff a little bit, as long as I don't cross that 1-inch border. Once it's established, I don't adjust it anymore. I'm going to reach in. I can go ahead and stabilize this package as long as I keep my finger within the 1-inch border. I'm going to, without crossing over this glove, I'm going to reach in. I'm going to come straight up. I can adjust this because this is all sterile to sterile. But once I get ready to commit my hand, I'm going to hijack my thumb. If my fingers don't go in, that's okay. I can go ahead, once I release that glove, I can make adjustments, but I cannot go within my 1-inch border. Once I have my fingers established, I can push them together, and that's where my gloves will stay. Then I'm going to come in, making sure only the sterile portion of my glove can reach into the sterile field. I'm going to go ahead and reach for the 4x4. I'm going to take it, and I'm going to drop it in my bowl. At this point, my sterile procedure is over with. How did you do? Are you doing okay? Great. I'm going to go ahead and clean my mess up at this time. I'm going to leave my gloves on, and I'm only going to clean up. I'm not going to touch my surface or anything. I'm going to just clean this up here. I'm going to grab this. I'm going to throw this away into the trash can. I'm going to grab my packaging. I'm going to throw this away. The last thing that I'm going to do is I'm going to grab glove to glove, skin to skin. I'm going to go ahead and do a medical hand wash. Okay, Miss Wilson, you doing okay? Great. Did you have any questions? No, you're good. I'm going to go ahead and get you into the lowest position. I'm going to lower my bed. I'm going to do, make sure my bed's in the lowest position. My side rails upper ×2 bed locks are in place, and call light is in place. Here's your call light if you need me. I'm going to make sure that I have everything gathered. I'm going to do one more safety check. Bed rails up ×2, call light in place, bed in lowest position, and bed is locked. All right, I'll come back and check on you here in about 30 minutes. Please feel free to call me if you need anything. I've closed everything down, and before I leave though, I'm going to go ahead and document. I'm going to document for, I'm going to assess for my sterility, make sure I stayed sterile for the whole procedure. I'll identify any expected or unexpected outcomes. Everything was expected and everything went like the way I expected it to. I maintained sterility. I would notify the healthcare provider if there was any problems or any abnormal findings that I found, and then I'm going to document. I'm going to document that I used sterile technique. If anything happened and sterility was broke anytime during the procedure, then I would document that as well. Once I'm done with my documentation, then I'm going to go ahead and exit out of that. All right, Ms. Wilson, let me know if you need anything. You have a great day. I'm going to do my final medical hand wash. I'm going to leave any extra supplies that are unopened except for the fluid in the room. So if they need to do another procedure, I'll leave that here, and I'm going to exit out.